it's depend very much on the type of patient that you get for CAR T cells. So if of course the best is to harvest the lymphocytes of the patient, produce them, and then admit the patient to the department with fludarabine, Cytoxan, and give them the CAR T cells. The issue is, and this go to the interplay between academic CAR T cells and the commercial CAR T cells, or where we stand today with the commercial CAR T cells. So in the academic CAR T cells, the patient, you get the patient, you harvest this lymphocyte, you need to have a certain amount of normal lymphocyte. You transduce them in 9 to 10 days. Meanwhile, you accept the patient to the department, you give fludarabine, Cytoxan induction, and after 5 days, 4 days, you transfuse the cell in. But when you have to ship in the commercial, you have to, for instance, if you are not, let's say in our country, you have to ship the cells to the USA, for instance, to get them transfused there. And then to go, the cells, transfused cells are being shipped again to your department. This may take a few weeks. And during this time, the patient can progress, and during this time, you need to give a bridge therapy. So I think that I hope, this patient usually showed already that they are resistant to chemotherapy. And the fact that you need to give them bridge therapy is because you don't want them to progress to a stage that they will not respond to the CAR T cells. But you have to buy time. So the bridge therapy you're giving only to buy time. You don't expect that the bridge therapy will cure the patient. So I hope that with time, with improving of the CAR T cells and the transplantation and all of this, and will be more centers, let's say, closer to the departments that give CAR T cells, we will not have to give patient bridging therapies that were allowed in some of the commercial study, and what was not allowed to in other studies, and again in the real life studies that were presented in the ASH after the pioneer studies that led to the registration. There were a higher number of patients in the real life that got bridging therapy.